Hello, everyone, and we are live for my second series. Isn't that crazy?
Ooh, that's crazy.
You know what else is insane?
What's insane?
For this series, we're gonna be having 11 guests and 11 concepts, and you're the number one episode. How do you feel?
As I should be. Honestly, I'm honored. This is like the greatest privilege of my life.
I'm so glad.
I just can't wait to tell this story to like everyone in
We're ready to
30
trauma
years
dump?
if I make it that long.
Yes. Okay, perfect.
Probably won't.
As you guys saw from the album cover, this series is going to be called The Revisiting Era. And what do I mean by that? It's a guest series where we discuss a topic that was relevant in our upbringing that is still relevant today. How have we been impacted by the subject negatively, and how can we utilize our growth and analyze our changes in perspective as we age to spread awareness on a subject that still creates upheaval to so many? How will you revisit your era? Stay a while and find out. The topic of today, I titled it Healthcare Horrors.
Spooky.
For this week's episode, I have my bestie Salma joining me to discuss the horrors of healthcare.
Hey, y'all.
Having numerous encounters with medical professionals for years, we're diving into our childhood treatment and discussing how these problems from the American healthcare system are still seen today. Join us as we expose our medical trauma, share our stories, and look at healthcare through a new perspective from our coming of age.
Get into it.
All right. Like I said, I have my bestie here. Tell us who you are. What do you do?
My name's Salma.
Who are you?
Oh, I really don't know. So basically, my job is working for the government. Woohoo. Basically, I work for people who are applying for disability, essentially just reviewing and working with them to get it processed and see what I can do along the way.
Wow, that's awesome. Thank you for sharing.
I had to be like generalized because I don't want to get fired.
Yeah, I understand that. We have to protect your privacy at all costs. That's very important.
Period.
Safety is number one. So you helped me come up with this topic, the first initial topic that is opening up this new series. What made you suggest healthcare?
You know, I don't shut up about my job, but I've also just like had a lot of healthcare experiences growing up throughout my life. The name says it all.
Yeah, I feel like on the daily we're always talking about some health issue, something that is wrong with us, so it seemed appropriate.
I diagnose all my friends because I don't trust doctors.
Right. No, but you're pretty good at it. And in my last series, like I literally talked to you guys about how I diagnosed myself. It ended up being surprisingly pretty accurate. Period. So I assume that's something similar to what you did with all the healthcare experiences you had and growing up.
Oh, for sure. I've diagnosed myself for years. It's the only way that any doctor has ever figured out what's wrong with me. No one really ever seemed to be able to figure out what was wrong with me, and I don't blame them because I can't either. But I can diagnose some things.
All right, so we're just going to dive headfirst into this topic. When you see the phrase healthcare horrors, you obviously think of something super bad. And I don't mean to talk bad about the American healthcare system, but it kind of sucks.
Yeah, that. For sure.
It sucks. A lot of people, I know I talk about trauma a lot, but there's so much medical trauma in people's lives. And I think that doesn't get discussed barely at all.
It never is.
I know I talk about complex trauma and how taboo a subject this has been in my life and in the lives of so many other people, and I'm sure you've seen the same with your claimants, with your clients.
Oh yeah, for sure. Honestly though, I think that's kind of what drives me in my work because I see a lot of different cases, talk to a lot of different people, read a lot of different records, learn about new things every day.
All right, well, we're going to start with question 1 and see what becomes of it. My first question to you is talk to me about interactions with the healthcare system growing up. Since this episode, we are very much focusing on what happened to us as children, what did we experience as kids, but how is our perspective different? How has it improved? How has it not? So really tell me about some interactions you had growing up. Like, where did it start?
I've been seeing doctors for as long as I can remember. I know that I was going to a bunch of different doctors from the age where I was only in kindergarten. My parents have told me how I was always having headaches and They took me to a bunch of specialists, and nobody could ever figure out why I was having all these headaches. They ran all these tests, did everything, never figured it out, kept having the headaches, but didn't figure out why until I was about 18, 19. So that was that. That started it.
Was that your first symptom, the headaches, you think?
Mm,
Because I feel like everyone has that one first symptom you remember from being sick first.
I would probably say physically, yeah.
Okay. Because for me, it was stomach aches. Like, my stomach would hurt for no reason.
I got the stomach aches later.
How old did you say you were when you first remember going to specialist?
I was in kindergarten.
Okay, so you were
At
like
that
around
time.
4, 5, or 6?
Probably 5.
5, okay.
I have one specific memory from when I was in first grade, and I was like, "Can I go to the nurse?" And the teacher was like, "Yeah, whatever." And as I'm going, the principal stops me on the way, and she's like, "Selma, where are you going?" And I was like, "The nurse. I have a headache." And she was like, "No, you don't. Turn
You're
it around."
lying.
Nope.
Oh, God.
She took me right back to class. She told me I was lying.
No way.
I literally was like, "Ma'am?"
Yeah, it's the fact that kids never get believed for what they have until it's something more,
Never.
like, drastic.
Until it's seen on an MRI.
Yeah, similar to you. I was around 5 years old when I remember going into surgery. I had an endoscopy done when I was 5 years old because, like I said, I grew up having these like stomach pains, and back in the day, they did not attribute that to anxiety. Like it was kind of known, but
But not
again,
really.
but not really. And
Not a lot was known about anxiety to begin with.
it wasn't, and then there's pros and cons to that because later in life, like they would only attribute like stomach aches to anxiety. Like now I see that being very
Tell
common.
me
But
about
back then it was like nobody cared. Nobody cared. You had a stomach ache, okay, cool. Like you probably ate something bad.
Take
So
some
that's
Pepto.
so that's what I assumed was happening to me. I remember my stomach started hurting really bad that night. In the end, like I think I just felt nauseous about something I don't know. I remember screaming my head off and not really knowing what was going on. I think we just ended up going to the hospital. I was like, you know what, let me cover it up, basically. So we got in the car. I went to the ER for the first time. He just told them like I was hysterical, like something was probably really wrong with my abdomen, like to take a look, like this girl needs to be seen. My 5-year-old child needs to be seen. And I'm just like crying over the freaking over being hit. But
It's the way that your dad will not believe you until you prove it to him, and then he will make it the most dramatic.
he is very dramatic. I will admit to that. So we get to the
Is that where you get
hospital.
it from?
Absolutely,
I knew it.
100%.
Your
See.
mom not about that drama.
Oh no, never. God, she hates that. She
She
hates being the
said,
center of
"I
attention.
only love the church."
Amen. Anyways, we get to the hospital and I'm like crying. And so they run a few tests. Nothing is wrong, obviously. I'm just gotta go to the bathroom. And then I remember getting back home, and in the coming weeks, like these stomach aches kept occurring and occurring and occurring. And my dad kept bothering doctors, which is a common theme that you'll see me tell you guys about, to the point that they were like, let's do an endoscopy on this girl. I remember going in when I was 5 years old. I had no idea.
That's crazy.
I was in the surgery room about to go under, and I just started crying because I'm scared. Like, I don't know what's happening. I knew this was bad because there were people in the waiting room with us praying for me. And I was like, this is serious. Like, am I gonna die? Like, do I have cancer? But nobody would really tell me what was gonna happen.
You know what, though? They probably didn't know. They probably thought you were literally having like a life-saving surgery.
Which is crazy. Like, it's literally an endoscopy. I went on to have 4 more later in life.
But you know, doctors, they
It's
don't
an in
take
and
the
out.
time
It's
to
an in and out.
explain that to
They
people in
didn't.
other
Also,
cultures.
given my parents did not speak really good English or understand any
That's what I'm
terminology.
saying, yeah.
But yeah, I do have this distinct memory of one of the nurses. One of them like was like, look at the balloon. Like as I was going under, like you're blowing up a balloon, whatever. The other nurse was like, you have no reason to be crying. Told me to be quiet.
I hate bad nurses. Like, why? Who told you to become a nurse?
She told me as a 5-year-old girl, and I think it was so traumatic that I remember it at 24. Like, lady, I have never been in an operating room. This looks terrifying. There's a bunch of metal. I'm cold. I'm naked. Like,
Honestly.
what do y'all want from me? I'm 5. Like,
I mean, honestly, same. And I was like 14 in
Yeah.
my first procedure. And I woke up with no idea where I was.
I was like, where am I? But anyways.
I couldn't even speak because it was my my throat.
Mm-hmm.
And I was choking.
Oh my God.
And she yelled at me for choking.
Oh my God.
And I was like, can I please have water? And she was like, you can have water when you calm down.
Uh,
And I was like, but how am I going to calm down if I don't have water? And then the other nurse is like, can we give her water? And she was like, no. And so she wouldn't let the other nurse give me water. And then as soon as that other nurse went away, she brought me ice chips, the nice one. And she was like, here, I'm sorry. I don't know why she's not letting you have water. Because, like, my throat, they give you, like, something to dry your throat out. And I was literally choking. And she just, like, kept yelling at me to calm down when I was crying.
I hate that. What other health issues did you start seeing as you grew up, like as a kid into adolescence? Like what did you encounter basically?
So the main experience that I had was when I was diagnosed with thyroid issues. There's not a lot to do other than take your meds, check your labs, follow up. The follow-ups were like every 3 months, and I was diagnosed around the age of 10, I believe. From the age of 10, I got to go see the endocrinologist. They would bully me into tears.
Damn.
Yeah, they're like getting mad at me because I forgot to take my medication. First of all, y'all can't tell I have ADHD.
Also, you're a child.
Literally.
Yeah.
10. And they were like, you didn't take your medication at this time and this day, and you ate breakfast? Are you kidding me? Do you want to die? They literally made me feel so horrible every single time because I wasn't taking my meds regularly. Definitely developed a lot of weight and had a hard time losing it. And so every time I would go into the doctor, they would yell at me for gaining a pound instead of losing 10, or I'd lose 2 pounds and they'd be like, well, why didn't you lose 12?
They're never satisfied.
Never
satisfied.
And they could be big themselves. Sometimes they would just look at you and be like, you're fat. And their biggest thing they'd do to me was, as a 10-year-old, I had no idea what diabetes was. And they loved to throw that at me. Salma, you're gonna get diabetes if you don't lose weight. You need to lose weight now or you're going to become a diabetic. And that's going to lead to a whole bunch of issues, and you don't want that. You could end up on insulin for the rest of your life. Like, I'm traumatized. I was so terrified that I was going to get diabetes, all because I had like a 0.1 elevation to prediabetes. They would literally torture me every single time. And that led to multiple different attempts to treat it, I guess. Literally everyone. Like, I would go to one appointment and then they'd end up sneaking me into like 3 others. Just because they were like, she's fat. Need to go to the nutritionist now.
Wow.
And then I'd get to the nutritionist already in tears. And she's just like, why don't you try diet sodas? And I was like, aren't those for old people? I have Sprite every now and then. Diet. Ew. She was just like, yeah, no, just do diet. That's okay. Also, let's try the Special K diet. That's where you eat cereal for 2 meals a day. And then your third meal is very small in portion and is essentially meat.
What? Where are you getting any nutrients from the Special K diet?
And we're talking about the cereal, folks, not the illicit substance. None of that. That went on for the next 8 to 9 years of my life. Every 3 months, follow up, go in. The doctors would make me feel terrible about myself, and then they would scare my parents into believing that I was gonna die. And then I would not only have to get yelled at by the doctor that day, then I get to go into the car for the next hour on the drive home and get a lecture from whatever parent took me that day.
Why is the drive always an hour? Because that was my experience as well.
And then for the next week and a half at least, they watch everything I eat. if I squirted too much ketchup, it was like
Your
crime.
wow.
Like, this is literally like my entire life. It got so bad that at one point I was only allowed to buy salads in the school cafeteria for lunch.
No, like that's something your parents just set for you, or other people were holding you accountable?
No, my dad, he like told them. He was like, she's not allowed to get anything other than a salad.
That's messed up.
And those salads were so bad.
Oh yeah.
Half the time they had pork on them anyways.
Oh god.
So there was that. But there was always that one lunch lady who'd hook me up with the French bread pizza. She was a real one. But yeah, so that really led to very unhealthy food practices for me.
Yeah, what I'm hearing is they set you up to have an eating disorder.
Period.
That is all that was. I was reading Jeanette McCurdy's biography, obviously. I'm glad my mom died. One of the best books I've ever read. Literally, her story is so similar to yours.
Really?
Yeah. She talks about all the abuse from her doctors and her mother specifically.
I haven't read it.
You have to read it. It's really good.
I've been
Basically,
wanting
everything
to.
you're
I
saying,
love, like,
this girl, like, if you see her, like, look at iCarly. This girl at that time was on, like, all these diets. Her mom scared her into
I've
thinking...
heard about a lot of bad things happening to her.
Into thinking that, like, because she was gaining weight, because she was developing, she was getting sick. You gotta read it. I don't want to spoil anything. That's why I'm not getting into too many detail, and that's her story to tell, not mine. But yeah, that's what you just said just reminded me of that book.
That's a teaser.
And
now I have to read the book.
You have to read the book. Anyways, no, but thank you for sharing. It is like... That is crazy because as you tell me like your health stories, like over the years that we've known each other, everything that comes out of your mouth, I can say like I have been there in one way or another. Because for me, like my health issues started with my gut issues, my GI issues. A very crazy thing that happened to me that not a lot of people know because this is not normal whatsoever is that when I was an infant, I was never given milk. I was never given breast milk, let alone formula. I don't know how babies survive.
Absolutely. Insane.
How do babies survive? And also, how are my bones so strong? I've never broken a bone.
See, you know what, though?
Isn't that crazy?
Like, I just think Nadia's built different.
I'm
like,
built different, yeah.
Nadia got some sort of, like, super gene in her that has been saving her all these years. Like, I don't understand how she has been through so much and still is so healthy. Like, she got COVID... And she was like, I'm going to go for a run when she had a fever. Who goes for a run when they have a fever? Nadia. She does. She comes back. The illness was gone.
It was gone. I took a nap after. I woke up and by the grace of God, I was healed.
I was sick for the next week.
Yeah.
Okay, great.
I love that. Anyways, this is going to change the whole mood terribly so. But my mom noticed when she was breastfeeding me that I wasn't taking in the milk. Like I would spit it up. I didn't like it. I rejected it. So my parents took me to the pediatrician. And back this was like the 90s. The doctor made a joke. And you know how I know it was a joke? Because it's the most absurd thing I have ever heard. My mom did not speak a word in English when I was born. She immigrated to the U.S. literally that year. So she didn't know. She didn't understand. My dad did. He was in America since he was 12. I don't think, was he there or not? I don't know. The doctor basically said, oh, she's not drinking milk. Give her some juice instead. And my parents took that literally. Why? I don't know. Since I was an infant, like a baby, until I was 5 years old.
What blows my mind is that nobody said anything. Like,
well,
nobody
there was
outside.
No one. They didn't know anyone. There were two people living by themselves in a basement. They wouldn't know. For the next, I want to say until I was 5 years old, like I was drinking juice from a bottle, from a sippy cup every night. My mom, before I went to bed, would prepare, like, you know, that Tropicana, like the juice you drink, the juice you get at a grocery store, you know, for every now and then.
Tropical.
Something like that. I had that every single day of my life, 3 times a day from the ages of 1 to 5.
What?
As I slept, I would take sips, go back to bed, sips, go back to bed. I didn't drink milk until I was about 8 years old.
It's the fact that you were living off of juice.
I mean, I ate food as well, but like thinking of it from like a child doing this every day. You know what juice is? Acid.
Sugar.
acid and sugar, 2% juice, because back in the day, like there was red 40 in this stuff. There was chemicals,
Oh, she
processed food,
loves
sugar,
her.
fruit, yeah, but very
This
minimally.
is throwing me back to the nutritionist days.
It was that Dole fruit juice in like the cartons. I don't know if you remember that from the 90s. You remember Dole?
Oh yeah.
Yeah, they had different flavors. That's the main one I can remember that we got. I was drinking that for a period of like 5 years straight.
That's crazy.
Until the point I got sick. Because I told you, like, when I was 5, I was hospitalized for my stomach issues. I think that's when it caught up to me. And then we discontinued the juice.
I mean, I can't imagine all that acid was very nice to your stomach lining. Okay, but you know what? Like, look at you now. Like, honestly, I do look at you now, and I want to know the formula. How are you built like this?
I don't know.
You're so healthy.
Am I, though? Because one day I feel
Girl,
like
you
I'm
got
going to
some
get
acid
tested.
reflux. Like, I could take, if I had your problems, I would literally be an Olympian, physically at least.
But fast forward, I'm 16 years old, lying in bed, and I wake up with my mouth full of acid. I'm like regurgitating this acid, and I'm like, what's happening? What's happening? And then
Crazy,
for
me
the
too.
next, because up until now, every single night I go to bed, I regurgitate acid. It comes up my throat. And I have to sit up and drink water, sit up, do whatever, digest. Like, it is such a process that now it's second nature. It's like going to the bathroom now, me having to sit up in my sleep.
And for those who don't know, like, acid reflux isn't really like something that can just be fixed. Like, a lot of the time it's maintained by like medication. Even just seeing like my own family's experiences with stomach problems, because that's a family-wide issue. You take them, they work for a bit, then they don't, then it makes it worse. A cycle.
Yeah, and that's when my health journey began at 5 years old. Ever since then, I was in and out of a specialist, like GI specialist, for my colon, for my digestion, for my esophagus, and nobody could figure out what was wrong. I kept declining. So over the next few years, I would drain my parents' only supply of money with my doctor's appointments. I would see specialists. I was going to the National Children's Hospital in DC. I remember that's where we were referred to for my GI issues. I met with like the same doctor, I feel like, for about a span of 5 years until he passed. During that time, he gave me like at least 2 endoscopies, I remember, and then I had my final one when I was 15 because they just couldn't figure out what was going on. But they knew it was something with the lining of my stomach. They thought, was it an ulcer? Is it a tumor? Like, is something not properly placed in there? And every time they would run these tests, I would come back normal. I never had an abnormal result with whatever stool sample I did. So there was a whole mystery around my health and why am I so sick all the time? I remember the number one issue being the nausea. I suffered a lot from nausea, and it was at the time like being a little girl with little vocabulary because I don't know any better. I didn't know how to describe nausea. So my mom would be like, do you feel this? Do you feel like this? Do you feel like you have to throw up? And I would say no, when in reality I said yes, because in the back of my mind was like, if I say I have to throw up, the doctor's going to make me throw up. And that's when I developed this huge fear of throwing up that I have. What is that called?
Emetophobia?
Something like that. It's a phobia. I have this huge fear of throwing up. Yeah. And that's where that stemmed from, because like I can't describe my symptoms because I'm scared. Like my mom like somehow got it into my mind that if I have to throw up, they're gonna make me throw up, and I do not like that feeling. It's very traumatic. And I would all the time when I was 7, because at the time I was living in such like impoverished conditions. I was filthy. Like everything I ate and put in my mouth was dirty. I would throw up every day. When I was 7 years old, I was just sick, always sick to my stomach, throwing up blood and bile.
That's so bad. How did she make it this far?
I don't know how I made it this far, but I mean, I don't know. I was fragile. I've been fragile since a young kid because, like, yes, we lived in a basement full of bugs and roaches, but, like, I feel like anyone else would have come out of that without getting sick that much.
I don't think so.
You think so?
No, I really don't think so, because I don't think they would have survived. Like, it's giving failure to thrive, if I'm being honest.
It is for sure, but that was after
you beat the odds.
Things got better. I did beat the odds, but going back to my issues, I had a couple issues here and there, like my heart rate, it's irregular, my eyes, I'm like nearsighted, like little things like that. My mouth, like all my teeth falling out. Another traumatic thing that happened to me, which I think I should mention as part of what this healthcare episode is I did talk about this in my last episode. I talked about how all my teeth fell out because they were rotting from neglect.
Wow.
By the age of 7, I had lost all my baby teeth.
Thank God we have adult teeth because it's the second chance.
You can see pictures, like I talked about this. My teeth are black. If you look at a picture from when I was 5, my teeth are all black. They're rot from sugar and juice. It's the juice. It's the erosion. And imagine, like, that's something that was visible to me. Imagine what is inside of me right now. I can't imagine the effects.
All that acid with the lack of food, like, it's just bound to ruin not only your stomach but your esophagus.
Exactly. And then I want to mention, like you mentioned, you were abused by doctors, basically verbally, emotionally, mentally. I remember that so clearly. My pediatrician that I started going to when I was a child, I remember they just being like 2 white old men commenting about how I looked, my weight, that I wasn't eating enough vegetables, like little things like that, which I guess is normal for every kid.
But some of them are just out of pocket.
They're out of pocket. And then for me, I was very malnourished. That was in part due to poverty, not eating enough nutrients. My body wasn't absorbing them. The question is why, like, we never figured that out. And it was until I was an adult that I was able to gain a normal weight. But my whole life I was underweight.
I'm going to pull my diagnosis card and just throw in stress.
Yeah, so given, like, I was in a very high alert environment, I was running on survival mode. And so my anxiety, my life at home, it was all taking a toll on my body at a very young age. I don't know if you can tell, but I, like, have, like, a inner, like, widow's peak on my head. I've always had that. From anxiety, from pulling my hair out at a young age, and it never came back. My hairline is weird looking, and I always got that comment, like, why is it indented? Like, why is the middle of your head always
I've
like...
never really noticed.
It's because it's gotten better as an adult because I've been less stressed. It's kind of grown back, which is crazy. But when I was a kid, like, it was significant.
Really?
There was, like, a freaking, like, indent, crescent in
Not the
my
male
forehead.
pattern age baldness.
Yeah.
Sorry, that was out of pocket.
No, but it was crazy. Just things like that they never noticed, and I would always be commented. The comments were like, "Just take some deep breaths. Just chill out. You're a kid. Like, stop stressing. You're a kid."
Wow, that's so helpful.
You're gonna tell that to a child who has to witness her mom getting beat every night. Like, I'm sorry if that's too TMI, but I mean, it's my podcast.
And
like, you know, it goes to show, like, gaslighting. We haven't said that once, and that is all that it is. It's gaslighting.
Yes.
We were gaslit as children, and
so hard.
That word was not a thing. Back
Never.
then, it was never a thing.
I don't even think anyone knew. Like, I think it was known, but it was, like, known by the adults that used it.
Absolutely. Basically telling us, why do you look like that?
Oh my God, gaslighting is, like, literally you make somebody upset, right? Like, you sit here, you verbally abuse them, you tell them all these bad things, they start crying, and then it's, why are you crying?
You have no reason to be crying.
Like, what are you crying for? Grow up. Like, oh my God. Like, you think I didn't have to deal with things like this?
Oh,
like,
absolutely.
I never got to cry over this. Like, it's literally taking all of your emotions and burning them.
Invalidation.
They literally are like, I don't care.
Like, they're like, you're a child, be an adult.
But also, you're a child and you know nothing.
You know nothing, and then you're being forced to grow up way faster than you should, and that's traumatic. The stress, the anxiety, like all these little symptoms that I had, but we're not so little in the long run because as of right now, I like struggle. I have thyroid issues. I struggle with what I eat. I have my esophageal issue, which is still a mystery. I have so many side effects from medications I was put on. I was put on so many medications, but I would never take them regularly. Like you said, I'm a kid. I don't want this. It made me feel terrible.
Honestly, it's hard. Like, who even thinks about these things? Like, you're a kid, you wake up, you go get breakfast, not your pills.
Exactly.
Like, the only people around me at that time that were taking pills was my grandma.
Yeah.
Like, even my parents weren't
My
taking
parents were
pills
not
like
taking
that.
pills. I was like, why am I so sick? Like, I always question, like, why am I the sick one? I don't get it. I don't get
Exactly.
it.
But then they're always like, why are you the sick one?
And then, yeah, exactly. Putting the blame back on me, like, if only you ate more vegetables last week, like, you should just eat better. Like, look at us. We eat like this. You should eat like us. You wouldn't be sick if you did this, if you did that. So it's just
If only
ongoing,
you kept that
ongoing.
special K diet up.
Is ongoing. And, it messes with you. It messed with my mind. It lowered my self-esteem. It spiraled me into an abyss. But,
For me, it's really taken away my ability to trust myself and my judgment. Like, I don't believe myself, and I'm constantly preparing to not be believed. I am just like always thinking too hard. Like, how can I prove to somebody that I'm going through all these things without sounding like it's fake? But
right.
also, I've been trained to prove what's going on. And like at the same time, you try and prove something. Well, then everyone's like, "Oh my God, what are you trying to prove?" Like, I'm I'm sick. That's what I've been trying to prove the whole time. But you know what, actually? Like, thinking about it, growing up, like, I was always in the doctor, always this and that. I don't think I was a sick child. I really don't. I
Right.
don't think I had any other issues other than the thyroid problems, being a little chunky, and mental health.
That right there, that what you just said, I also don't think I was sick. I was just malnourished. I lacked nutrients because when I turned 14 years old, I started eating and making choices for myself. I'm going to eat this salad. I'm going to try those vegetables. I'm going to eat 3 meals a day. Believe me or not, like, I think it was like, yeah, the 8th grade through like my sophomore
That's
year,
crazy.
I gained like 20 pounds. I looked like everyone else in my grade for once.
That's
And
crazy.
I was like, yo, like my mind was blown. I was like, whoa. It was all in my diet because for those 3 years, I felt healthy. I was healthy. But then again, at 16, my stomach, like every couple years, like every 4 to 5 years, my stomach would just take some severe, like sharp decline, and I would have to have the endoscopy again for them to tell me I'm normal.
Yep.
Again, with the blood work, like I would have it ongoing, draining my parents' pockets and then blaming me for being like for costing too much money because I'm so sick.
Still don't understand why money is how we determine who gets to be sick or not.
Who gets to be
But
sick? Who gets what? Who gets treatment?
like, why does the fact that somebody has money mean that their cut is more important than somebody's cancer? Like, make it make sense, America. Just saying.
It doesn't make sense.
I see that a lot. Like, not only from like friends and like others around me, but like work.
Tell me more about that.
Oh my God. Well, as soon as you lose your job in America, there goes your health care. But then you lose your job because you're sick. You're too sick to work. So now that you're too sick to work, you're too sick to get medical treatment because you're poor. How is anyone supposed to not be poor then if they can't get medical treatment? It's like, how can you look at someone and say, "Oh my God, how are you still working? Like, you poor thing. You shouldn't be working at your age or with your conditions." Oh, but you stopped working.
Right.
And so like, we can't really treat your conditions anymore.
This definitely goes into my next question. How did like our culture as two women of color coming from an immigrant household, how did this impact our interactions with the healthcare professionals? Like how were we treated?
Oh man.
There's
Well,
so much to this. We're gonna try to keep it brief for y'all, but
oh Lord. I mean, Nadia knows. I'll go into this one in depth. I see it at work. I see it in my life. I see it in my friends' lives. It's literally insane how much even just being a woman makes a difference in the healthcare system, and women of color especially. I don't understand how people can look at them and just jump to assumptions that they're not ill. Again, like it goes with the thing of having to prove yourself, but then as soon as you prove yourself, you're a liar.
the amount of times we've been told we're not sick.
Oh my God.
The blood tests are normal. This level is normal. You're
I
not
don't know
sick.
why
You're
she's
normal.
having
Yeah.
headaches.
There's no reason for you to be doing this. Just do some meditation.
She's just making it up so she can get out of class. I think it plays a part where, especially in childhood, when you grow up as an individual of another nationality in this country, especially if your parents are not fluent in English.
You're not taken seriously, and you never will be.
You literally have to be dying in front of them and physically force them to watch the blood drain out of your body before they will believe you. As a child, it's even worse because, like, at least for my parents, like, growing up, they were very culturally, like, in their mind, you know, these are doctors. Doctors know everything.
They held them at such a high standard.
They know everything. They know what's best for you. A doctor said this, so it can't be a lie. Like, I've heard my dad say that recently about something crazy, like some weird supplement that was like, literally, he was like, I heard Dr. Phil talk about it. Like, bro, what? That's not even a doctor.
Not Dr. Phil.
Like, dog, what? It's crazy because they will get inside their heads. They can literally say whatever they want. And our parents are going to believe them because what more do they have?
They don't have any resources. They don't have anyone to tell them, like...
And then especially with your case, like, there wasn't even a translator available.
There wasn't.
Like, how is she supposed to know?
How am I as a child?
Who's advocating for them?
No one's advocating. I remember the biggest struggle was communication. I can't put my symptoms into words. Therefore, I don't have symptoms. So that was it was so frustrating because I was sitting there like something is wrong, but my mom is not able to speak for me. So we have to lie and pretend it's okay, or she has to do the best she can to convey to the doctor that I am sick. One specific frustrating, if not the most frustrating experience I have with doctors is when I was at the pediatrician. I went there until I was 17. This was, I think, one of my final appointments with them is when I tried to get an ADHD diagnosis. I was struggling so much in school. I remember I couldn't focus. I have never been able to focus. I have never listened to a class. I have been failing classes since I was in 4th grade. And my mom, like, I finally got her to understand, to think that there was maybe something wrong. And she was like, you know what? I'll take you to a doctor if this is what you want. And I was like, yes. I tried to explain to this doctor as best I could that I had ADHD. He was not buying it. The thing he said to me was like, you just want drugs, is what he said to me. This old white man looked me in the eye. I was 17 trying to advocate for myself.
God forbid.
I was like, I seriously, like, I need something. I didn't even know what Adderall was. I didn't know what it was, but he just threw straight away. He was like, you don't have ADHD. If you did, you'd be squirming in your chair, running around, whatever.
Oh my God. I think they think ADHD, especially back then, they used to think girls never had ADHD.
Girls never had it, the whole stigma. Like, I mean, okay, boomer, like...
Boys will be boys. They're just rowdy and always jumping in their seat.
Yeah.
Like, no.
He had the interview with me, like, asked me, like, do you think you have it? I was like, absolutely. He was like, no, you don't. Then he had my mom come in. I had to wait in the other room. And he asked her, like, do you think she has it? My mom, bless her heart, she was trying her best to tell him that I had something, trying to side with me. And I felt like she was doing something for me. I don't know. I felt really good that she was gonna talk to the doctor, standing up for me for the first time, and he didn't believe one word she said. He laughed in her face. She couldn't speak English, and like, she tried her very best, and I did not get medication until I was 20 years old.
Another thing I experienced a lot was every time I felt bad and I asked to go to the doctor, I was literally gaslit so hard. It would literally just be like, oh my God, for what? There's nothing wrong with you. You're fine. Like, this went on for the majority of my life. I was going to the doctor so much, my dad started bringing them donuts.
Whoa.
They literally knew me. They would take me in, like, same day, just because they were like, yeah, it's Salma again. Well,
oh, wow.
Like, I have so many bad things about my pediatrician. Like, even just, like, the cultural thing again. I had a doctor who literally called my mom after the appointment to tell my mom, I think your daughter has too much testosterone because she's got a little hair on her arms.
Mm.
Like, I don't think that's normal. Like, dog, we're Afghan. have you seen our people? Like, what do you mean?
That's
Like,
crazy.
I was sitting there listening to that on the phone and I was
Mm-hmm.
blown. I was literally fuming and I was looking at my mom like, are you listening to this? And
Mm-hmm.
my mom is just calmly like, okay, whatever, whatever. My mom hangs up the phone. I'm like, are you like, I'm not doing
He's not
this.
for real,
Like,
right?
I'm
Like,
not doing this. I'm so tired of them telling me
mm-hmm.
something. Like, oh my God. Like,
Mm-hmm.
it's anything I do. They will
Mm-hmm.
comment on my physical appearance until the day I die.
Mm-hmm. They're after these kids. Like, why are you beefing?
Oh my God. It's just like bullying
It's
them.
bullying from
Like, it's
adults to a kid.
it's fun for
Mm-hmm.
them. I don't get it. This would obviously just lead on and on and on into the pattern of not being believed because my symptoms were just not real, I guess.
Mm-hmm.
It took until I hit like the age of 18 to realize that I have really bad anxiety. I really only realized how much it affects my physical health when one day I had a panic attack and I got that lovely little headache after. And I sat there and I was like, this is the same headache that I would get in class all those times. It's a stress headache.
You made that connection.
Oh my God. I just diagnosed myself 20 years later.
Mm-hmm.
They took me to John Hopkins, bro.
Oh my.
And they couldn't figure out I had anxiety. Like, I was literally having panic attacks. I was crying all the time. I was
Mm-hmm.
such a scaredy cat. Like,
Mm-hmm.
I distinctly remember the fear every time I walked into my house as a child in like broad daylight. I would run in from the garage, broad daylight. And yet no one realized I had anxiety.
Back in the day, I know, like, I've mentioned, like, ACE scores and how now it's common for when you go to a checkup, the kid is going to get asked, like, does this happen at home? There are going to be certain questions that kind of, like, pinpoint, like, is this child in a harmful environment, like a violent environment? And we have that now, but we didn't have that back then. So, as you can see, like, I was obviously in a domestic violent household. They did not ask. I remember this one experience that truly sticks with me is I was around, I want to say 11 years old, and I was seen by a female doctor for the first time. She made my parents leave the room because I was having like my physical, and when they left the room, she was like, I need you to tell me, and I need you to tell me right now if you're being abused. And my parents conditioned me to lie, say we have a perfect family, no one's being hurt, no one's hurting you.
You can't trust them.
You can't trust them. I remember this lady pressuring me. My eyes were watering because she was trying so hard to get me to admit that something was wrong, and I knew something was wrong, but it took everything in me to lie to her face and say, "No, nothing's wrong.
And it's
I
like,
am
what
fine at
choice do you
home."
have?
What
Because
choice do you have? And I was mad at her for doing that, and I didn't realize it until now. This lady saw something in me, and that could have probably helped me in some shape or form, because my parents didn't believe in therapy or anything like that. There
and
could have
keep
been
in
some
mind,
intervention.
keep in mind, you do not need a child to admit being a victim of abuse to report suspected child abuse, especially as a mandated reporter.
We both got social work degrees. That's how we met.
Period.
Where social workers are mandated reporters.
We will die.
If we see something, we report it. We're so quick to do that. No child should be
It's literally like
living in that.
I see anything and I'm like, oh my God, one thing at work I saw was like this person, and I was just like, I told my boss about it. I was like, this is sus. And they were like, yeah, but their doctor would report it. And I was like, that's kind of where I was like, okay. Like, we literally read medical records all day. You see everything these doctors miss.
Right.
Like, we see it all the time. And I think it just blows in, like why do they need to torture us
Mm-hmm.
through the process. Like, you're supposed to be protecting us.
Mm-hmm.
And instead, you're literally abusing us.
Mm-hmm.
It just, there's no reason for it.
There really isn't. You were saying how our parents never believed us. I have a great story for this one.
Mm-hmm.
When I was 9, I fractured my ankle at a resort.
Wow.
I was at the beach with my family. I was 9, and they had the little kids club. I don't know if like you guys ever went to like a resort where they had like little kids clubs.
I think I remember what you're
And
talking
I
about.
was like, oh, I will do anything to not be with my family for an hour or two. So I was like, please take me to the kids club. When I was at this resort and I went to the kids club, I literally walked in. It was like 10 minutes into it. I met this girl and I was like, hey, want to be friends? And she was like, yeah. And I was like, okay, bet. And so we started playing these games with like the leaders who were like there. They set up like these inflatable tubes. And they were like, it's like hopscotch, like you jump in. And I was like, yo, this looks so fun. And my friend did it first. She was like, look, watch this, I can do it. And I was like, yo, that's so cool, let me try. I jump once, I jump again, my right ankle goes inward, I hear a pop.
How?
I fall to the ground, and mind you, as a child, my pain tolerance was insane. It was beyond. I would mask it so well. I remember
Symptoms of abuse.
being on the ground, and I was like, oh shit, I can't move my leg. It hurts so, worst pain I ever felt
That's insane.
as a child. Something popped, something's wrong, my ankle is twisted, I can't put pressure on it, I cannot stand. I remember like this girl like kind of helping me up, and I was on one foot. And I was just jumping on one foot. No, but none of the leaders saw. They were really distracted. There were so many kids there by that time, so it was just me and my friend. And they took us to this ice show, and I remember
Not the
like
ice show.
yeah, because it was like right across the auditorium where this thing was happening. They
Your
took us
whole
there.
foot is fractured.
My foot is fractured. I am limping. While we were watching the ice show, I kid you not, I was on my left leg the entire time. I was in so much pain. I remember it ending, my parents picking me up. I was like, Mom, I can't move. I can't stand on it. And she was like, what? And I was like, I can't put pressure on my leg. Like it hurts so bad. And she told my dad to have a look at it, and he was like, whatever, like I'll massage it, whatever.
No.
And I was like, he did it, and I was like, ow, this hurts low key, but like, I mean, it's straight, it's not bent anymore.
He
like
snapped it?
He didn't. No.
Oh, God, I was so scared.
But he was like, you're fine, basically. And I was like, no, I'm not fine, because for the rest of that trip, I was limping. I remember we got home, I was crawling, and I was like, can I please go to a doctor? I think I broke it. Something's happening. Like, is it not normal? I never went to a doctor.
You're lying.
Nope. All they did, I think my dad like bandaged it up and made like a makeshift cast with it because I was complaining too much. Never had crutches. I till this day never got treatment for it.
Have you ever had an x-ray or anything since?
I haven't. I've never had x-rays for my bones.
Which foot is it?
It's my right foot, the one that's currently hurting right now.
Crazy.
Because my whole life I had issues with that foot till this day.
You know what? There are days I've seen Nadia where she's like, my foot.
And it's always the right
just
one.
gives out.
It is
It's
always the right
I'm
one.
always like, what just happened to you? Like, she's on the floor and she's like, I can't move my foot. Like, ma'am, I'm about to order you an x-ray.
That's my origin story.
Oh my God. Oh my God. Well, okay, I'll summarize it. But basically, for my end, I was a sophomore in high school, and by this time, I had been through the run of it. Selma, oh my God, you always want to go to the doctor, blah, blah, blah. You're fine. You just want to leave school, whatever. I remember distinctly my mom was like, go turn the car on. And I was like, okay, because it was cold and it was winter. I go outside. The special little child that I am did not duck my head low enough to get into the car. Mm-hmm. Yes, I am telling all of you this. And if I hear anyone clown me about it, I will cry. Yeah, so I basically smashed my head. Didn't realize it at the time, but have realized it now that I blacked out, fell into the seat. When I woke up, I was like, ow, my head hurts so bad. And then I instantly got nauseous, tried to run inside to go throw up. I was falling everywhere. My balance was horrible. I literally looked like a chicken. Like, my legs didn't work. And I just kept falling, and I get inside, I throw up, I'm like, oh my God, like everything is spinning. And I tell my mom, I'm like, Mom, like I don't feel well. I hit my head. I think I have a concussion. And this is like in the peak of like when concussions actually became a discussion, but only in terms of football players. And my brother was a football player. So, the only knowledge of concussions my parents had was the mandatory concussion training they made the parents go to for the football players. Essentially, my parents kind of had the mindset of like a concussion. Like, you get that from like serious injury. Like, you don't have a concussion, you bumped your head, dingus. And I was like, no, I'm messed up. Like, I can feel it. I didn't really know what a concussion was, to be honest. But I, like, briefly knew of it. Like, where you injure your head, the first symptoms are, like, dizziness, nausea. Yeah. I was like, Mom, blah, blah, blah. And my mom was like, girl, you're faking it. Just let's go. You're going to school. Get in the car. Go to school. Got homeroom. Go into the class with my little homegirl Reem. And I go in there, a little geometry. Teacher gives out the classwork. I look at Reem. I'm like, girl, I feel like I'm dying. She's like, girl, you look like you're dying. I was like, girl, I literally hit my head. She was like, what did you do? I was like, I bumped it on the car. She's like, you're so dumb. I was like, tell me about it. And then the teacher gives out the classwork. I pick up this paper and I can't read. Like,
Oh, wow.
the words, I don't even remember if it was like I couldn't understand the words or if it was like the words were just swirling everywhere. I feel like it's more likely that it was the swirls. I get to school and I'm like, I can't read, so I make my best friend text my mom. My mom is like, girl, what? Whatever. Calls my dad. My dad comes to pick me up. He's like, oh my God, you're making me late for work. I'm so over this. Like, you just want to get out of school. This is annoying. Like, do you realize, like, we're paying money to take you to the doctor? Like, stop faking it all the time. I feel like I'm gonna die right now. And I get to the doctor. I tell them, I'm like, I think I have a concussion. They give me the concussion test. Not even 1 minute into this test, they look at my dad and they are like, she has a severe concussion, like TBI level. You need to take her to the hospital to make sure she's not bleeding from her brain.
They told
because
them.
she's literally that bad. Long story short, I had a TBI, had to do physical therapy for like 8 months, couldn't do anything in school. Like, if you asked me to do like the heel toe walk they do for like a DUI checkpoint shit, I was falling all over the place. I couldn't stand up straight. I remember making the joke to my physical therapist, like, if I get pulled over while driving, like, can I just call you? And she was like, you don't even have a permit. But yeah, so after that is when everything just really took my downfall. It really characterized how much the doctors were persuading my parents that there was nothing wrong with me. Because my parents were not the type to not believe me initially. They would believe everything. They took me to all those doctors as a kid. Like, the doctors, they just changed their minds. They convinced them. This kid is just making this up for attention. And it's like, well, what qualifies you to say that this is an attention thing? You see me for 10 minutes. How do you know that this is fake? What's telling you this is fake? If I'm telling you it's real, if my mom is telling you it's real, why isn't it real?
That's horrible that happened to you. Like, I'm so sorry.
Yeah,
But like we've been saying, these doctors, man, they really do not care.
Yeah.
It's the lack of empathy, it's the lack of trust, the lack of dignity and respect, I think. And it's not only for people of color, it could literally be anyone. But I think just like we're sharing our experiences, and so that's where we can get that from. All right, that moves the discussion along to our discernment on what helps and what doesn't. I think we were talking about this before, how we differentiated between encouragement versus threat and fear. What we experienced from doctors or medical professionals was threats and fear. We were told all these terrible things that made us fear doctors, made us distrust the medical system, people around us that were trying to help. Maybe they genuinely were trying to help us, but we just couldn't trust them. So that spiraled our health. By encouragement, what do you mean? What do you think has helped you the most by healthcare professionals?
I didn't have a good doctor until I reached adulthood and was able to go to these doctors by myself because that's the only time I actually felt comfortable. Once I started going to the doctor again, it was really hard for me. It took a lot. It only started because I went to the dentist because I literally needed a root canal because I was refusing to go to doctors. Yeah. Anyways, that doctor was like, girl, you need to go talk to this doctor. Then that doctor was like, girl, you need to go see this doctor. And I was like, please stop referring me to new doctors because I hate doctors. One of those doctors, I think it was the second one, he was like, girl, you really need to see a rheumatologist because this test came back. And I was like, oh my God, no. I only came to see you because you were the only doctor who didn't bully me as a child, and you were the one who did my surgery, so I literally saw you once. So then I went to this rheumatologist, and this is the first doctor that has ever inquired me about my experiences with doctors. Like, she genuinely wanted to hear why I wasn't following up with doctors, because she was trying to be like, girl, like, you really need to see an endocrinologist. Like, you have thyroid problems. If you don't take the meds, like, that's what the issue is. And I told her, I was like, I don't want to go. And she was like, why? And I told her all about it. You know, they made me feel horrible. I don't trust anyone. Like, I'm terrified of it. She literally looked at me and was like, Selma, you were a kid. They should not have been yelling at you like that in the first place for forgetting to take your medication. You're a kid. Kids don't remember to take their meds. It's normal. Like, I'm so sorry that you had to experience that. And I want you to know, like, your feelings are valid. I understand why you don't want to see one, but you really need to see one. And I was like, please, for the love of God, do not make me. I don't even want to find one. Like, I'm not going to look. I can't. And she was like, you're not going to look. And I was like, I'm not going to look. And she was like, okay, then we'll look right now. Pulled out her laptop, started looking up endocrinologists for me, looking at their reviews, trying to help me find one, encouraging me to just schedule one appointment. And she told me, if this doctor is mean to you at any time, just stop going to them and find a new one. And I think that blew my mind because I had been like seeing the same doctors over and over and over again.
You don't, yeah, it's you gotta leave your abuser. You can't stay stuck.
But I really think it was just her acknowledging, like, why I wouldn't, and taking the time to explain to me that, you know, I hear you, I see why you don't want to do these things, and I don't blame you, but, you know, it's really important for your health, and these are the reasons why, and I'm not going to make you feel like terrified or anything like that. And she really just took the time to help me understand. So I really do think it's just that one-on-one time, but also that understanding and compassion. I don't think a lot of doctors have a mindset now, especially I've heard in America. Visits are not long. They're 10 minutes, you know? You don't really talk to the doctor. You tell the nurse what's wrong. The nurse summarizes it to the doctor. They're in and they're out.
It's so necessary for professionals to be able to validate the patient.
It's just the understanding.
It's the understanding. It's the ability to give grace. To give yourself grace has been something so impactful for me to understand. Like, we were kids with issues outside of our control. It was never fair. Everything was against us. But it's the ability to find forgiveness and solace. We put so much pressure on ourselves as children, and that in turn killed so many areas of our lives, our self-esteem, our ability to interact with certain people. It killed so much for us. I have a similar experience. Like I said, I left my pediatrician after that horrible ADHD situation where they just refused to give me treatment for that issue. And then I moved to a different primary doctor. This one was for like adults only. It was the one my dad had started going to, and he was like, he was like, you know what, come to my doctor, whatever, I'll pay for your health insurance. Like, love him. Thank you, Father. So I went to this new doctor for the first time. My girl Brenda was Hispanic. She was, I don't know where she was from, but she was from Central America. I'm Salvadorian. We made that connection instantly. Like, she really was open and personal and like genuine, and like she was so friendly and like had such a happy, like positive attitude with every patient. She was like, hello, like, my name is Brenda, like, nice to meet you, let's go over your medical history. I told her everything. I was like, I've been to this many doctors, I've had this many issues. Like, I just start pouring it out, like, and she listened. I was expected, like, every 5 seconds I was like, I can stop, like, I'm sorry, like, it's too much, like, and she was like
apologizing.
it's the apologizing to doctors, like, I'm sorry, it's such a hard case.
I'm taking away your time from all these other patients who need you, because
I'm
I'm
a
so
case.
worthless.
Over time, I did gain that comfortability with, like, I felt so comfortable with her. Like, she was like my therapist, bro. I was telling her all my health issues, and like she wouldn't cut me off, but there were some times I really did go over my time, and she was like, girl, can we move to the next one? I gotta make another appointment with you because it's too much.
I love when they're real like that.
But they're real. She was real, and she was like, no, girl, I get you. Like, I've been in your shoes. I'm a doctor because of what you're telling me right now. And I was like, wow, thank you. And so that happened for about 2 years, and then that's when my mental health relapse occurred, where I got really sick. It was in 2020. I was seeing her, and I was seeing her regularly. Like, I was like, everything is wrong with me. I don't know what's happening. She was the one I initially went to start on my diagnosis, like, psychiatric examination journey. She referred me to where I got those tests done and everything. I remember telling her I'm having suicidal thoughts. I trusted her to a point that I knew she was not going to call the police on me, and she never did. She was like, she's like, you can tell me, like, please be honest with me. Are you having suicidal ideation? I'm like, yes. I want to hurt myself. I hurt myself every day. I shoulder my scars. And she was like, okay, girl, like, we're going to work on that. She put me on a lot of medications too, but besides the point, I don't know. We were trying to find something that worked.
The natural
she was trying.
Like,
she was trying. I would tell her a symptom, and she was like, there's something we can do for this. And I love that she was so eager and not denying me any treatment. She wanted to help me, and I really appreciate that.
That's the difference.
That's the difference. But I remember one time I was in such a horrible state. My face was puffy from panic attacks. She could see that I was crying, pale, like I was not eating. She was like, why did you lose 30 pounds? Like, what happened? And so I was like, I'm going through it. Like, I don't know. I don't know what to do. And she was like, we're going to get you some help, and we're going to do it now. And she was like, have you been calling? Like, I gave you a list. I was like, I've been calling, but nobody can take me. Like, it's COVID. And she was like, fuck it. We're going to figure it out right now. She called on my behalf. And I remember the lady on the other end picking up and yelling at her, at my doctor, for speaking for me. And she was like, my patient has anxiety. She cannot speak for herself. And she took all that attitude from this woman.
I love that.
It took about 30 minutes of convincing. It was funny because there was a nurse in training in the room with us while we were doing this call.
Oh, man.
I hope she took notes. Like, this was crazy.
The
look on her face, this girl was scared. This girl was like, whoa. But she took so much attitude and sass from this lady on the other end. I got my appointment. I was moved up from the waiting list, and I got to see a psychiatrist for the first time. But yeah, she did that for me. And then I opened up to her how my parents did not believe in mental health. Like, it was such an issue. And she was like, girl, I get that. It's Hispanic parents. That's what they do. No, she asked me, like, can I have your mom's number? Can I talk to her? And I was like, yeah, sure. Good luck. She called my mom later, and my mom was denying whatever she was saying, but she literally, like, was like, straight up, your daughter is mentally ill, like, she's sick.
Help her.
And it's the fact that she was able to talk in Spanish to my mom, who did not speak English. It made such a difference.
It's also just that level of, like, establishing, I'm with you, like, we're from the same places, I get it.
I remember my mom telling me, like, hey, your doctor called. My mom was in tears, and all she could say to me was, I'm so sorry. I get it now.
Wow.
And yeah, so that was my doctor. She left the practice, unfortunately, after I ended college or whatever.
Girl, we gotta find her.
I've been trying to find her, but, like, I can't.
We're gonna work on that after.
And I don't like my doctor right now, but I mean, it's not like I go. You know, it's that lack of trust that I lost with the healthcare system and insurances and all those issues that I do not go to doctors. I can't trust them. I have a big issue with trust, like you said. Like, I am a holistic queen. I will do alternative medicine till the day I die because I'm so traumatized by my experiences with medication.
That's funny. I have really bad medication experiences too. The main thing thing I would say though, like for doctors, just recognizing that a patient is still a person.
Listen to us, please.
Just listen. Just act like you care. That's what you're here for, to provide care, not to throw pills at someone or not believe somebody just because they didn't check your boxes. You are supposed to be the person that sits there, listens, and helps us, because you are supposed to be somebody that we can trust, the same way that our parents wanted to put trust in you. But how can we put trust in you when we saw all that trust that you gave our parents and let us down so hard?
Period. I wanted to discuss our impact. Where are we now after all that? Physically, where am I now? I have chronic disease. I'm gonna die. I was at my doctor, I think a while back, 2 years ago. Oh, and we were talking about how much my esophageal issue was like growing. And she was like, girl, if we don't do something, you're gonna have esophageal cancer in 20 years. And I think hearing that was a blow. I don't know. It's the thing that like all that we went through, we're suffering the consequences now. We're in our mid-20s. We shouldn't be going through this as two people who were born like pretty normally. I mean, my birth story is something else, but I mean, we were born pretty normally. We have family that is generally healthy. We should not be as sick as we both are. A lot of the issue is the healthcare system. We were neglected. So daily living, like it's hard. I struggle a lot with fatigue. I have blood sugar issues. I have to eat all the time. I pass out all the time. I have a lot of issues with sleep and eating and all that. I mean, what are some of yours? Name like 3. What you got?
Every mental illness in the world.
No.
Oh. Okay. I mean,
we're not talking about mental. Physically, how you struggling?
Obviously I have pain and stuff. Like I've always had that.
We have chronic inflammation.
Do I feel like it's enough to go to a doctor? No, because in my mind I still have that ingrained feeling of it's not really that bad. It's just in your head. And I got a load of issues, but do I want to go see these doctors? No. Let me tell you what, cuz I still don't go see doctors, y'all. Okay? Like just the effort to find a doctor alone is too much. It puts me out. I'm done.
That's the impact mentally. Like I said, we fear going to doctors. We have this skewed perspective on treatment. At least I do. Like I said, like I can't do big pharma. I cannot be relying on prescription drugs, even though they keep telling me like your disease is gonna get worse and worse and worse if you don't start taking medication.
Along with the self-diagnosing aspect, I just realized that I need to sit here. I mean, obviously I shouldn't have to, but I will take at least several months of bearing whatever problem it is and hoping it'll go away just so I don't have to go see a doctor. And then it develops to, okay, it's not going away, but I still really don't want to see a doctor. And even if I did, they're going to tell me they don't know what's wrong with me because that's what they always do. So I need to figure out what's wrong with me first.
We are so hesitant to make any decision.
Unless I find out that I'm literally gonna die. Like, if it's not that serious, I will push it off.
Yeah, and like as adults now, how are we navigating our health? Like me, we're not. We struggle every day actually, and we think we're gonna die every single day. I am 24 and I feel like I'm in the body of a 64-year-old woman.
Honestly, I felt that way since I hit like 15.
No. But what are we doing? I take supplements. I exercise. I try to at least, but I really don't. I sleep too much. I cry. I validate myself. We help each other cope. I think in the end, just meeting other people who have gone through similar circumstances like you have has been crucial to our healing.
Just talking about it with each other brings things up. Like, you have no idea the connections, the emotions, the insight it gives you into your own experiences and your friends, those around you. These are things that people don't feel like they can talk about, but they're things that people want to talk about.
And then it's a huge emphasis on consent with doctors.
Mm.
As we're adults now, we get a consent to what we want to have done and what we don't. I feel like as children, we were kind of forced to have these procedures, forced to do this, forced to see this person. And it's the ability to have choice. Like, we're in a place in our lives where we will get to decide, and no one else will get to decide what happens to our bodies except us.
For me, I think I was probably better when I was being forced to go to the doctor.
I'm gonna force you to go. I don't care.
Just because I have very poor compliance because of the mental toll it's taken on me. I think it did make a difference having my parents kind of force me to go to these things, scheduling them, all of that, because they knew I wouldn't. And then obviously, as soon as I turned 18, I didn't. Consent is big, yeah. But also, I think it's important to realize that not everyone feels like they can express what's wrong with them to a doctor, or they just think that their problems are not significant.
This is slightly off topic, but I know both of us struggled with dependence on medication.
I
I
still
think
do.
it's something we skipped over. There was a point in my life where I was on 5 to 8 medications for my mental health.
Me now.
I was on medication for schizophrenia when I didn't even have it. Look at how absurd that is to give a...
Damn, they gave you one of those.
They gave me one of those. I hallucinated. It was crazy, but that's something I really want to tell in another episode.
I really want to know what medicine that was, actually.
And
like,
I don't even know. I remember just throwing it away after I was done. I was like, I'm done. I'm never gonna look at this again.
We're gonna figure that out.
I doubt it's in my records. But it's just things like that.
If you feel like your medications help you, please don't stop taking
That's
them.
wonderful. Like, that's great, and that's amazing that you found something and you had a healthcare professional there to lead you in that direction that allowed you to help find something that works. Like, that's what everyone wants to find in their doctor. Like, give me a solution for this issue, and if you found it, that's amazing, and I wish you the best. But in our experiences, for the most part, we haven't found that most of the time.
And if your doctor is not willing to listen to you or explore other options when you tell them things are still not going well,
you got to get a new doctor.
Find a new doctor.
You got to go somewhere else.
Please do it for your own love, for your own health, for your own safety, because you are the only person that will ever be able to take care of your health in the way it should be. No doctor can do that for you.
And we care about you so much, so please help yourself.
We literally love you so much. Everything I would say that all of these experiences have shaped me into, I am so empathetic, and like, I want to hear people tell me their story, tell me what's wrong, because people don't let others talk. It's so important to just get your feelings out, to feel heard.
Yeah.
Like, I experience it all the time at work. Oh my God, these people vent their whole lives to me, and they're like, I never told my doctor this because I'm so scared they're gonna judge me.
Right, that's powerful. Right there. But yeah, so that basically summarizes. There's so much more that could have gone into this discussion, but we went so many places because it's just us. Like, welcome to the show, first episode. That's why I picked her.
Welcome.
Yeah. But our 3 takeaway points from this episode, like, please don't forget what we're gonna say. Number 1 is Salma, how can doctors do better?
Emphasizing the fact that just because something doesn't look like how it seems doesn't mean that it's not real. Just focusing on people versus facts. How people say these things are affecting them and what they actually want from what they're telling you. Like, I think a lot of people, for example, one, I know this is the end, but it goes back into like the culture thing where, like, you know, a person of color goes to the doctor, they're like, I'm in pain, and the doctor's immediately like, you want opioids? Nope. But it's like, damn, I don't even want opioids. Can you just fix my back? Just listen. Inquire. Don't jump to conclusions. I know you're a doctor. I know you think you know everything. Maybe you do. But damn, take some time to think about it.
Right. For the second one, encouragement versus threat from medical professionals. What builds a trusting relationship in a doctor? We mentioned the avoidance of guilt tripping the patient.
Threats don't help.
Threats do not work.
There's a time and a place, okay? I will say sometimes threatening is necessary in terms of like severity. However, continuously threatening somebody over and over again, it's not working. Explore new methods, because clearly these threats mean nothing. There has been no change. So help them identify What's keeping them from the change?
Oh man, we got some strong feelings up in this joint.
I could talk about medical for literally days.
This is the perfect topic for us then.
You know it is.
Okay. Third key point, takeaway, healthcare bias. It just speaks for itself.
Honestly, healthcare bias is BS. Just because someone has more money doesn't mean their problems are real. If anything, they know that they can get more from a doctor, that they can take advantage of things because their insurance supports it, and their doctor has no reason not to trust them because they're a wealthy, middle-aged, well-appearing person. Why would they lie? Just because somebody's poor doesn't mean they're lying.
It's the whole insurance debate, and we didn't tackle even 1% of that, but I mean, there was a time where like I did not have health insurance, and like you can imagine like the cost of these medications were costing my parents a fortune, given we were below the poverty line for most of my life.
Costs, man, they're crazy.
They're insane. There was one antidepressant, it was $500 a month for me.
Insane. Insulin, man. Oh my god.
Insulin. Talk about this whole epidemic.
My claimants literally die because they can't get insulin.
They can't afford it, and it's absurd because if you look like, it's a whole chain. It goes kind of like this. You grow up poor, you're not going to have adequate resources, you're not going to have good food. Obviously, that's going to make you sick. You're going to get sick. These people are going to
blame us for
They want to blame us for everything. And of course, sick people need medication. Sick people need treatment. But are they going to get it? No. So the cycle continues. They're going to keep getting more sick and sick and sick, and then you die. It's not fair.
And if you go to doctors too often trying to find someone to believe you, then suddenly you're doctor shopping.
Those intake exams are not free.
Oh my God. They love to say that people of color are just shopping around for drugs. I'm sorry, I want a doctor that's going to listen to me and not call me a drug addict.
But again, not all of them. We're not throwing shade. I know I have met so many incredible doctors. I know a lot of people are starting to become medical professionals, and they are great at what they do. A lot of nurses that I know, they are amazing people, and I know they have touched so many patients' lives, so we are in no way like degrading like the general population of doctors.
And I'm sure that the doctors that have caused us significant trauma have done something good in their life. I would hope.
I would hope so, yeah.
But like, again, focusing on these outliers, because it really does make a difference in an entire life. Like, this started as we were kids, and now you've shaped our lives.
Yeah. And we're here now talking about our experiences. So that is the point of the series that I wanted to come across. I'd like to thank my guest today, Salma, for being on this first episode with me. You did so good.
Oh my God, it's a privilege. You know I love to talk. I can't wait to get clowned for everything I talk.
No, we're not doing that today. But until next time, next week.
Y'all got Claudia next week?
We give it up for Claudia. We're going to be talking about fake friends. It's a topic you guys will not want to miss. Are you excited for this, Salma?
I'm excited. I want to watch it. I want to be there. I love listening to you and Claudia.
Excited.
Claudia's about to throw some tea.
This is going to be one season you guys won't want to miss.
Oh my God, this season got me on my toes. I want to come back.
All right, guys, don't forget to like, subscribe, and follow me.
Follow.
This podcast is available on Spotify, iTunes, iHeartRadio, and YouTube. And of course, if you guys want to follow my Instagram, it's going to be XOX Nadia with, I think, stop repeating. Stop, it's annoying. XOX Nadia with 2 underscores, not 1. That's my old account. It got hacked. The one with the verification check mark.
Ooh.
But yeah, guys, don't forget to keep up with the latest on what is the revisiting era. Until next time.
Let's
bye, guys.
Revisit Nadia's podcast.